Hi, my name is Dr. Kyla. I am a chiropractor here at Thompson Healthcare in Sports Medicine. One of the things that I am specialized in training is with pediatric and prenatal chiropractic. So here we have our patient Bryce. He's our little guy here. We're going to check him. He's had some reflux in the past. We've altered some of his formula and the way he's feeding, but every now and again it still acts up. So his mom's been taking him here. How old was Bryce?
4 months. 4 months.
No. When you first started coming.
He was about a month old.
Like a month, right?
Mm-hmm.
So ever since about a month old, he's been coming in. So for the last couple months, we've been working on him. So I'm just going to show you a little bit of how we do our pediatric exam and how we adjust. It's very different from the way we adjust adults. It's very, very specific, very gentle, and a lot of the times they kind of just hang out through it, or sometimes they sleep. Sometimes they can cry just because we are kind of poking and prodding, but it's very, very, very light and very comfortable. So, hi. Hi. And Bryce is a superstar. Yeah. Hi. Hi. Do you hiccups? Do you do hiccups? Yeah. So we're just loosening up his lumbar spine, kind of stretching him out, getting those SI joints to move. Yeah. Did we see here? Oh, I see. So Bryce has a little bit of a head tilt, and actually I'm doing a leg check on him, and it tells me which part of his cervical spine is misaligned. So we do a really, really easy correction on that. Hi. Yeah. Say it's so easy. Hi. It's a super light, sustained hold. You don't go any firmer than if you were to press on your own eyelid, so that's how really, really light the contact is. Hi. Yeah. Yeah. Good job. Good job. Then I like to check his tailbone. Hi. He has a little bit of a harder time coming to one side, so we just hold it. This is a technique from, it's called SOT. Hi. Say hi to everyone. You're going to be famous. Yeah, you're going to be famous. And then I'm just kind of palpating his lumbar spine, checking for all the movement. And then if we find one that's a little aggravated or kind of stuck, a lot of the times the nerves that come from the spine and the upper thoracic spine innervate the esophagus. So a lot of the times you want to check those if they're having any reflux issues. Hi. So this one, so we're just going to hold it here. Hi. Yeah. Good job. Good job. Good job. And I'm just going to work on his belly. Hi. Say hi, everyone. Good job. Good job. Yeah. Hi. Yeah. Good job. So that's all we have to do with him lying face up, and then lying face down I like to check what's called the sacrotuberous ligament, and in order to do that you just look for a little gluteal, we call it a gluteal fold, which is kind of right above the glute area. I already did it before the video, so I know that actually we call it a left AI sacrum. So I'm going to lift him up, and then put him on his belly, and then we just, super baby. And we just release this little ligament really close to the tailbone. Yeah. This ligament a lot of the times will calm the baby down. So babies that that are colicky, having trouble going to the bathroom, trouble sleeping, a lot of the times this ligament is always really tight. So if you can relax it, sometimes what you'll find is that the baby will actually go to the bathroom right in your lap. But it's a good thing. Yeah, it is. Yeah. He's doing awesome. Good job. Mm-hmm. Good. Good. And that's it. That's how you adjust a baby. It's super easy. Yeah, say hi. He's happy, all good, and, see him next time. Yeah.